Hello, everyone. Welcome to ELI, the only podcast in India where we bring a new founder on every episode to talk about their journey and their story of building a startup. And today we have with us Masaharu Morita, who is the one of the
Hello.
co-founder and program director at Nura, which is a subsidiary by Fujifilm, and it's developing India's first AI-powered health screening center. Hi, Masaharu. Welcome to ELI.
Hello. Very nice to meet you, everyone.
To start with, Masaru, would love to hear about your journey first. Set the context for our listeners. What has been your background? Where are you from? Which all ventures have you worked on? And how did you arrive at Nura?
Sure. My name is Morita. I'm based in Japan, Tokyo. I was born in Japan, 1982,
Mm-hmm,
and I joined the Fujifilm company in 2005. So now, around 20 years, I'm working in the same company in the Fujifilm,
mm-hmm,
and I start from healthcare directly. Basically, the many my colleagues start from photography in the Fujifilm and move to healthcare department, etc. But I joined from the healthcare from the beginning, so 20 years I spent time.
mm-hmm,
And firstly, I started in healthcare like logistics, marketing, international marketing. But I moved to Dubai for to establish healthcare business for Middle East and Africa from 2010.
mm-hmm,
So from that time, I opened the eye, not from Japan, but also from developing countries to see all over the world, and especially Middle East and Africa. It was very, very dynamic, and I learned a lot of things. So whatever I could feel is a lacking point of Middle East and developing countries, this is
mm-hmm.
what I'm trying to fill the gap by technologies. So this kind of things I'm doing, yeah.
Got it. Can you tell us a bit about the healthcare wing of Fujifilm? I think almost everybody knows Fujifilm as a camera filmmaker. I think
Mm,
it is one of the two OGs of the analog camera. I think along with Kodak, Fujifilm is one of the
correct, yes.
legacy companies. But nobody knows about the healthcare wing of Fujifilm. So tell us about it.
Mm, yeah. So Fujifilm start medical business 80 years ago, actually.
Oh, wow.
So how we start is X-ray film. You know, Fujifilm is a photography film, but medical film as well we started. So from 80 years and 90 years ago, we started photography business and immediately like medical film we start.
Mm-hmm.
So how to make a good image quality for medical? It's the same as photography actually.
Okay.
So by this way, we got a good experience for the medical imaging. After medical imaging start for this analog film, then we made a digitization first, 1982. So first digitization happening by Fujifilm, this analog film become in a screen monitor,
Mm-hmm.
digital film. And after that, we made a pack system with like a healthcare IT and analytics. Everything start for digitization. And now I can see the image from here to US or Europe to somewhere. Everywhere in the world is connected by digital, same way as a normal consumable business.
Mm-hmm.
And we acquired after that some several companies, and the majority is Hitachi Healthcare we acquired. So then now become a total healthcare company for medical imaging. So include CT, MRI, X-ray, mammography, endoscopy, ultrasound, everything. So we become one of the biggest medical equipment company in Japan. Yeah.
Got it. Got it. Uh, I think people are aware about these small techniques like X-ray, ultrasound, but can you tell us about the extensive set of use cases of imaging in healthcare? So, people do not realize that healthcare is very much dependent on imaging technology. And which
Mm.
all use cases have you developed over the years, and which are you experimenting right now?
Okay. So firstly, for example, in Japan, now anywhere people live, for example, in a like small island very far away from Tokyo,
Mhm.
before they were struggled for the healthcare service because sometimes the normal doctor in Ireland cannot see the deaths of the human. But for example, in Tokyo, is a head office like a quite a key opinion doctor, for example, they
Mhm.
can identify the problem easily. So it's connected by digital. So anywhere I will be there, I can get a good support, good healthcare service from from Tokyo, for example. This kind of connection happen, then quality of service is improved. And for example, in the US also, for example, we are supplying this healthcare IT for US military and army, everyone.
Mhm.
So the doctors, for example, US military bases everywhere in the world. So they can connect with IT and all over the world. They can track the healthcare or health condition of soldiers, for example
Mhm.
by from US headquarter doctor. So this kind of good innovation is happening. So of course in India also same. Many hospital is using centralized IT system. So this kind of things we are supplying actually.
Got it. Tell us a backstory of Nura. How was it formulated? What was the hypothesis behind it, and what problem are you trying to solve?
Yeah. So Nura come from technology and one of the lacking of things in developing countries. For example, when I was in Dubai, I have to take annual health checkup in Japan. This is an obligation for all Japanese people.
Mm-hmm.
So annual check for the lifestyle disease such as heart attack or diabetic or and also cancers. So, but we can check annually. So we can find at a very, very early stage or before cancer happening, we can find it and we can solve it. So that's why for Japanese people, cancer is very much treatable and diabetic and heart attack is avoidable.
Mm-hmm.
But unfortunately, for my friend, everyone, they never take this kind of service and it's not existing this kind of preventive culture in developing countries.
Mm-hmm.
So this is what I realized by myself. So that's why I communicated with the many minister of health in Middle East and African each countries, but they are very much busy to establish hospital. Hospital is for sick people, but what I'm saying is preventive health is healthy people. So they cannot manage everything by themselves as government. So that's why we decided, okay, why not us to start this kind of things by ourselves. So we showed one case study in Bangalore. We created Nura. So we invite normal, healthy people, healthy individual to our center to identify all health whole body by imaging basis, and we could find many abnormality inside the body, and we could solve it. So this kind of concept was pretty much hit in India, and
Mm-hmm.
now we are going all pan India and also UAE, Africa, ASEAN countries. So we are going everywhere in the world. So actually, this concept is created by Japan society, but newly created with the Japan and India collaboration, actually.
Got it. And are you only targeting India market through Nura, or are you, also? I read a article about Nura Center opening in Mongolia, and you are also expanding elsewhere as well. So, can you tell us what are the target markets?
Yeah, target market is actually everywhere in the world. Basically, what I'm trying is try to bring this kind of good culture or developing countries who doesn't have this kind of service. So this is my mission and aim in my life.
Mhm.
So basically now we are opening in this year, opening Dubai, South Africa, and Lebanon, Morocco, Egypt,
Mhm.
Philippines, Malaysia, Thai. So everywhere we are trying to open it. Yeah.
Got it. Tell us about the role of AI and latest technology in transforming early detection of cancer and other lifestyle diseases. I think AI has been a buzzword in every industry, especially in healthcare, because its ability to predict things in future. So, how are you leveraging AI, and what are some of the great use cases which has evolved?
Hmm. So basically, before maybe health checkup, health screening in India was only blood test. So take a blood test, blood sample, and then check cholesterol or triglyceride, this kind of things only. But this kind of things cannot find all disease. So what is our unique point is we can scan your full body from head to toe, and we can visualize your inside organ. For example, like you can see by 3D visualization your heart safely,
Mm-hmm,
your kidney, your liver, your pancreatic, everything you can see visible. We cannot see your body organ inside from outside, but we can see with scan.
mm-hmm,
So we can identify, oh, your heart coronary artery is little blockage you have. You
mm-hmm,
don't know, never. You never know. But we can identify. You may have a heart attack risk. You reduce it, cholesterol. You reduce triglyceride. Then you will be safe. Or we can see, oh, you have some abnormality or bit damage of a liver.
mm-hmm,
This liver start from fatty liver, but this become cancer now. Better to remove it now. Then you'll be safe. We can say like that.
mm-hmm,
So this kind of imaging is a basically is a doctor radiologist could find it, but sometimes it's from head to toe. Everybody is very difficult to define only eye of naked eye of human, even super doctor.
mm-hmm,
So AI and doctor is collaborate to identify your body from head to toe. Then, like doctor, it can focus its abnormal area, and AI support him to alert. So this kind of the human and the technology collaboration we are making as Nura.
got it. And I think AI is also being used to quickly produce a comprehensive report. So when you were taking so many images and compiling them, it should take a human at least a week's time to compile them and come up with meaningful analysis on top of that. But I think you are using AI to do that within 120 minutes. So tell us about it.
Yeah, exactly. So basically, from a medical specialist standpoint, our health checkup is not urgent. So if you come, you are healthy man, you come, okay, we will give you 1 week later for the report or 2 days later. But from consumer standpoint, you are a consumer, you want to know immediately.
Hmm.
Always people immediately I want to know. After the scan, immediately I want to know. This is the psychology.
Right.
So we made it this in this way, consumer way. So as I'm consumer, I want to know immediately. So that's why we utilize AI and the doctor. Immediately we can define, and then even doctor no need to be on site every time. Doctor can be anywhere else. So we can pick up any abnormality by AI, and then we alert to the radiologist and specialist doctor on the cloud basis, and they will do the report, and immediately report will come back, and our GP doctor in front of me, she will explain everything in front. So
Mhm.
by this kind of technological way, we could manage these 120 minutes.
Got it. How do you sort of create awareness in the market? Because as you rightly said, in India, people are not really concerned about their health till the time something is wrong in your body and you go to the hospital to treat that. But preventive healthcare is not yet popular in India. So how do you create that awareness and acceptance of preventive screening among Indian population?
Yes. So actually, it was a trial and error. For example, in Japan, this is the obligation. Everybody have to go annual health checkup. So that's why we could take a customer directly. But for example, India, it's not like obligation. It's a voluntary basis. So what we could find a way is we will take a lot of good feedback from the customer, for example, like from yourself, and then we distribute this kind of voice to the market. For example, you come to Nura and you feel, understand like, oh, this is my liver, this is my kidney, this is my heart. wow, it's very meaningful, very understandable. Oh, I want to treat my father, mother. You will bring your father and mother. And your father and mother come, oh, wow, very nice. I want to come annually. Or I want to bring my brother, and the brother will come. So this word of mouth is very, very important. So always like we have to think like customer centric, and the
Hmm.
customer word of mouth is creating the buzz in the market. This is like what we are doing.
Got it. I think there is also a focus towards the B2B wellness. I think something like Nura Express has come up with a mobile screening center. You can go to locations and do the screening for a group of people. So tell us about it. How successful that has been?
Yeah, so actually, it's a Nura Express is a we considered to make more accessible service. So why we, as I said, why I start Nura? Because this is kind of unfairness. Japan has, but Indian doesn't have, and not affordable, not difficult approach. So even Nura, this service, we have only like a metro now, Bangalore, Delhi, Mumbai, and Hyderabad. So how we can access more rural area? How we can go the not only like headquarter office, but even like factory.
Hmm.
So by this concept that we created Neural Express, okay, we go, not they come. So, and then also like a more reasonable fee and a more affordable service. So this is what we are trying to do that. So if for the company like head office people who is locating in Bangalore, everybody can come to Neura. But
Hmm.
for the bit rural area in the factory, okay, we go by this pass, and all employee we can manage from our service, and then entire company is protected. So this is our aim.
Got it. Uh, One thing I recently read about was the data security aspect of healthcare. I think, especially at developing market in India, I think securing the patient data is not a adhered practice in India, because it's common to share data across data with other stakeholders in the industry. For example, diagnostic can share the patient data with the pharma company can share that with the healthcare corporate, and so on. So I think it's a practice in India where patients data is used as a leverage or a currency by different stakeholders. So how are you you know going about it, this what specific measures and ethical frameworks has Nura implemented to ensure absolute data privacy and security?
Mm. So basically, this Fujifilm is an international company and Japanese company. We have to follow the law in the world, patient data. So for example, in Japan, it's a patient data to provide to some hospital or even some hospital, some pharma company. It's not allowed. Absolutely against in law. Actually, it's in India also same. You have a law, the personal
Yes,
information
we
law.
have.
So if we do something like that, it's against in law. It's not allowed. So
Mhm.
we don't do that. So, and plus, basically, our AI technology is on-premise basis. We don't utilize, for example, cloud-based at this moment. So we develop this kind of AI, imaging AI in Japan, and we bring this medical IT technology to India and to each site. And we develop a server, AI server in each site, and then to do the process in each site. So basically, it's not like required to send images because actually medical imaging is very, very big data, 1 giga,
Yeah.
2 giga. We cannot forward and send, etc. So actually, on-premise is more makes sense for me. Yeah.
Mm-hmm. Got it. What about the future? What are the plans you have for future in India, in Middle East, and other countries you're expanding? And in terms of technology as well, what new ways of imaging, new ways of collecting data are you working on right now?
So basically, my aim is to make more affordable or accessible as fairness standpoint for all over the world. So now we are trying to open in, for example, African country. As I said, it's South Africa, Kenya, uh, even Ghana. So it's everywhere we try to open and then make accessible. This is my dream. But
Mhm.
our target is a 100 center by 2030. This is what I'm committing to my CEO, and our CEO also supporting. I don't know I can reach or not. It's up to our effort and society acceptance. But it's a very enjoyable dream we are creating. So hopefully we can achieve it.
Got it. Uh, I think Nura website also mentioned that a strong network of partners. I think you are working with different partners from the healthcare ecosystem. So, how critical is this downstream ecosystem of specialists, hospitals to your success, and how do you select and manage these partners?
Yes, so basically, we Nura as a health screening partner. I mean, health screening is we can say you are normal or abnormal.
Mhm.
So, for example, 80%, 90% people is very normal, nothing abnormal. But some 10% people is some abnormalities there. We can identify abnormal, but abnormal mean is cancer or it's like a small abnormal. We cannot identify everything. So
Mhm.
basically, we have to very strongly tie up with each special doctors and hospital group, and our customer guest. We call the guest. We our guest should go well treated and in each hospital, and then diagnosed. Then our customer, our guest will be happy, and the healthcare society also is linked, so this kind of eco cycle is quite important. And also, we are getting a lot of support from Indian medical equipment company, for example. Some eye test, for example, some
Mhm.
company is providing quite great product. So, for example, they are providing this kind of equipment to Nura, and Nura is using this kind of things. So it's like a strong ecosystem also covering up. So not only Fujifilm and Nura we are managing, but also as society we are take caring of all our guests. Yeah.
Got it. And finally, as a entrepreneur yourself, you have developed multiple ventures over the year at Fujifilm. How would you advise others who are starting out, especially in the healthcare domain, to start some venture and create some value, especially in a country like India where there are 1,000 problems to solve? How would you advise other entrepreneurs?
Yeah. It's a big question. I think India has a lot of opportunity itself because of so many missing parties there. But to fill this gap and to utilize this technology to go outside, so I think this is more makes sense. For example, if I'm in Japan always, I cannot find much problem because it's a very sustainable society. Of course, small, but it's not big. But in India, I can find a lot of big issues. So once by technology, fill this gap and utilize this experience to the world. I think this is a great opportunity. And also, your people can speak English very well, but
Right.
for example, other countries sometimes is not. So this is a great advantage. So I think it's a go out more. I think this is a more yeah, dynamic approach you can create. Yeah.
Got it. All right. On this note, we'll close the session. Thanks for joining us, Mr. Morita.
Thank you very
It's a
much.
pleasure to have you on a platform and best wishes for your venture.
Thank you.
Thank you.